Now getting into our fungal diseases, we have tinea, or ringworm. A lot of different fungi can cause ringworm. Topical creams can treat ringworm, and it gets its name. It's not a worm at all, okay? It is a fungus, but it gets its name because it kind of looks like a little curled up worm under the surface of the skin. Here's a very severe case of ringworm. Then we have tinea pedis, tinea cruris, which cause athlete's foot and jock itch, or which are athlete's foot and jock itch. Again, a lot of different fungi can cause these. Fungi like warm, moist areas, and so we talk about the feet, sweaty feet. We talk about jock itch in the groin area. Topical creams typically will clear up athlete's foot and jock itch. A protozoan of concern when it comes to the eyes is acanthamoeba. And acanthamoeba is an amoeba, which is a type of protozoan that can get into the eyes. And it can cause pain, blurred vision, tearing. It's very difficult to treat because it's in the eyes. If it advances, it can cause blindness. So when we talk about protozoans, we'll talk about two stages or multiple stages in the life cycle. And some protozoans can form cysts, and cysts are what allow them to survive in the water, because that's where typically these come from. But the trophozoite is the active form. So tropho means eat or feed. So the trophozoite is the feeding stage. So it's active. It's moving around. And this is what we can look for if we suspect acanthamoeba infection. So basically what happens is it causes this fogginess on the cornea. And so this fogginess is what can lead to blindness, and it can only be treated once it's gotten to this point by a transplant. So here's your cysts in the water, okay? Can get in, through the eye. And trophozoites also can as well, but depending on your water, trophozoites may not be able to get, they may not be able to survive whatever water it is. They can get in through the skin. They can also get in through the nasal passages. So they can lead, acanthamoeba can cause other types of infections besides just eye infections. All right, so that brings us to the end of chapter 21. So I hope this has helped explain some of these pathogens and diseases.